Hi, this is Brooke Lounsbury, registered nurse and expert contributor at CaringVillage. Each week I answer your questions about caregiving and offer tips and solutions. Medical disclaimer: although I am a nurse by profession, I am not your nurse. All content and information shared is for informational purposes and educational purposes only. It does not constitute medical advice and does not establish any kind of patient-client relationship. Always consult a professional who is aware of all the facts and circumstances of your individual situation before making any changes or decisions about your health or well-being. Preventing pressure ulcers. Pressure ulcers can happen anytime you are unable to get out of bed or are in a wheelchair for an extended period of time. Taking precautions while incapacitated because of illness, surgery, or disability will help you prevent pressure sores. The following was taken from the National Library of Medicine. Pressure ulcers are also called bed sores or pressure sores. They can form when your skin and soft tissue press against a harder surface, such as a chair or bed, for a prolonged time. This pressure reduces blood supply to that area. Lack of blood supply can cause the skin tissue in this area to become damaged or die. When this happens, a pressure ulcer may form. You have a risk of developing a pressure ulcer if you 1. Spend time or most of your day in bed or a chair with minimal movement. 2. Are overweight or underweight. 3. Are not able to control your bowels or bladder or have leakage of urine or stool. 4. Have decreased feeling in an area of your body, such as with neuropathy or anything else where you may be numb or not have feeling, especially in the feet. 5. Spend a lot of time in one position only. You will need to take steps to prevent these problems, starting with self-care. You or your caregiver need to check your body every day from head to toe. Pay special attention to the areas where pressure ulcers often form. These areas are the heels and ankles, knees, hips, spine, tailbone area, elbows, shoulders and shoulder blades, back of head, and, surprisingly, ears. Anywhere that you would lay your head on, especially like the ears, you can develop pressure ulcers or pressure sores. So call your healthcare provider if you see early signs of pressure ulcers. And these signs include skin redness, warm areas, spongy or hard skin, or breakdown of the top layers of skin or a sore. How to treat your skin gently to help prevent pressure ulcers. First of all, when washing, use a soft sponge or cloth. Do not scrub hard. Use moisturizing cream and skin protectants on your skin every day. Ask your doctor which ones they would advise you to use. Clean and dry areas underneath your breasts and in the groin. Do not use talcum powder or strong soaps. And try not to take a bath or shower every day. It can really dry your skin out. In addition, eat enough calories and protein to stay healthy and drink plenty of water every day to avoid dehydration. Make sure that your clothes are not increasing your risk of developing pressure ulcers by avoiding clothes that have thick seams, buttons, or zippers that press on your skin, and do not wear clothes that are too tight for you. Also, keep your clothes from bunching up or wrinkling in areas where there is any pressure on your body. Now, after urinating or having a bowel movement, be sure to clean and dry the area well. Ask your care provider about creams to help protect the skin in this area. If you are using a wheelchair, make sure that your wheelchair is the right size for you. Have your provider or physical therapist check the fit once or twice a year. If you gain weight, ask your provider or physical therapist to check how you fit in your wheelchair. If you feel pressure anywhere, have your provider or physical therapist check the wheelchair for fit. Some other things you can do is to sit on a foam or gel seat cushion that can fit in your wheelchair. Another good idea is natural sheepskin pads, and these help reduce pressure on the skin, and I know from working with patients that these sheepskin pads are absolutely a lifesaver. And another thing, do not sit on a donut-shaped cushion because it can cause pressure around the rectum and can make it very uncomfortable and cause more problems than it could help. Now, you or your caregiver should shift your weight, if you're not able to on your own, in your wheelchair every 15 to 20 minutes. And this will take the pressure off certain areas and maintain blood flow. And the way to do this is to lean forward every 10 to 15 or even 15 to 20 minutes, and then lean to one side and stay for a few minutes or a minute, and then lean to the other side. Also, reposition yourself if you're uncomfortable or feel that there's any pressure or there's any wrinkling of clothing or garments underneath your legs or your buttocks or even your back. Now, if you transfer yourself, which means moving to or from your wheelchair, lift your body up with your arms. Do not drag yourself. If you are having trouble transferring into your wheelchair, ask a physical therapist to teach you the proper technique. Now, if your caregiver transfers you, make sure they know the proper way to move you. If you are in bed and you are especially susceptible to bed sores when in bed, a few things you can do is to use a foam mattress or one that's filled with gel or air. The one with the air can either be static and just one level, or it could be an alternating pressure mattress, which is you can get from a prescription from your doctor, and lots of insurances do pay for it. They also say to place pads under your bottom to absorb wetness and to help keep your skin dry if you happen to have an incontinence episode. Use a soft pillow or a piece of foam between parts of your body that press against each other or against your mattress. When you're lying on your side, put a pillow or foam between both your ankles and your knees, not just your knees. When you're lying on your back, put a pillow or foam under your heels or place a pillow under your calves to lift up your heels. And this is another way to relieve pressure on your heels, which is one of the areas that can really get hit with pressure ulcers. Also, check under your tailbone area and make sure that the sheets are smooth and that there's no wrinkles and that there isn't any hard surfaces that your tailbone is laying on. Also, you can put a pillow or a small pad under your tailbone, just like you can your shoulders and your shoulder blades. And don't forget your elbows. So here's some other tips when you're in bed to think about and to consider. Do not put pillows under your knees. It puts pressure on your heels. So you'll just want to put them under the calves. Never drag yourself to change your position or get in and out of bed. Dragging causes skin breakdown and tear. Get help if you need help moving in bed or getting out of bed, in or out. If someone else moves you, they should lift you or use a draw sheet, which is a special sheet used for this purpose to move you. And they should be properly trained in knowing how to transfer and turn you. Change your position every 1 to 2 hours to keep the pressure off of any one spot. And like I said before, sheets and clothing should be dry, smooth, and with no wrinkles. Remove any objects such as pins, pencils, or pens that may have fallen in the bed, or coins. Do not raise the head of your bed more than a 30-degree angle. Being flatter keeps your body from sliding down, and sliding down can cause harm to your skin from the skin shear. Check your skin often for any areas of skin breakdown. And now we're going to go on to when to call the doctor. Call your doctor right away if you notice a sore, redness, or any other changes in skin that lasts for more than a few days, or becomes painful and warm, or begins to drain pus, or that your wheelchair does not fit, and you can tell that by the way you're feeling when you're in and out of it, if it's too big or too small. Talk to your provider if you have questions about pressure ulcers and how to prevent them. If you have a caregiving question or concern, please submit your questions by leaving a comment below or fill out our form at www.caringvillage.com/questions. I look forward to hearing from you. Until next week.